Morning, everyone. A very warm welcome to this workshop number 3. We will shortly begin our sessions by 11:05. The participants are just joining in. We're just waiting for more participants to join in. So, all right, everyone, a very warm welcome to one and all present here. We'll be admitting the other applicants as and when they join in, but let's begin the session today. So, thank you for joining on a Sunday morning at 11 a.m. This is your workshop number 3, where you'll get an orientation to the case evaluation. So, to begin with, let me call Mr. Biswajit to tell a little bit about Evaluate India. So, Biswajit sir, over to you. Oh, yeah.
So you are on mute, sir.
Yeah, I also welcome each of you for this session, and also welcome Dr. Ruchi and Dr. Nanji for their presence for today in this orientation on the evaluation case on the health sector that we have designed. So let me just introduce the partners. So this year we are supported by Bill and Melinda Gates Foundation and Development Monitoring and Evaluation Office under Niti Yog. Our knowledge partners are IRMA and its policy lab institution, and with other partners are Clear South Asia, and our evaluation case partners is Ramaya Institution's International Health Center on Public Health. So just to give you a quick background about EcoI and Evaluate India. EcoI is Evaluation Community of India. That's the oldest network, not-for-profit network that is in India for over last 6 years, which is doing primarily advocacy into the policy making of the evaluation and coordinating actions with Niti Aayog and Development Monitoring Office. Second, also doing capacity building through bringing all the institutions in Asia and national in India together to build a course and professionalize the evaluation profession. And third, they are also conducting a international scale global fest, which happens every year around the month of February, which is basically a gathering of all the evaluation experts across the globe. And last year we did it online because of the pandemic. And we, as Evaluate India, we are the young and emerging evaluator wing of EcoI. And the genesis of Evaluate India comes from its network called as Evaluate Global, which does capacity building in terms of creating programs in the form of mentorship and guidance. And then from that, we have several regional capacity building activities through regional chapters, which are in Asia, Europe, MENA, and many other many other regions. And in India, what we are doing is we have two flagship programs that we run. One is we are just discussing this competition, and the other is doing capacity building through various partnerships in Asia and across other continents where a lot of holistic learning happens for the young and emerging evaluators across cross learning from the global north and the global south. So I leave it here. I think then we spend more time with our speakers and on the questions that you will have about the process that will happen on 21st July. Thank you.
Thank you, Biswajit sir. And all of you, please keep noting down your questions. We will definitely be having a Q&A round after our experts and if you and all the interactions are finished, so that you can ask any doubts which you have, because this is your last opportunity before your actual D-Day to ask questions. So now over to Mridula, who will now give you a brief about IECC 2022.
Hello all, good morning. So welcome to the third session of India Evaluation Case Competition 2022. And we already have discussed about this, but just to remind you all that in the case competition on 31st of July, you will have only 7 hours. And in the morning time itself, you will be receiving the case, the real case that will be given to you, and you have to work on it. And if you have any questions, because this is a very good opportunity for you all to ask any questions from the ones who have created this case. So I would now like to invite our speakers. Anshika, let's go ahead.
Yeah, so thank you so much, Mridula. Now, I would like to take this opportunity to invite Ms. Dr. Ruchi Vadhya. It's a great honor and privilege to invite her. She is currently the Assistant Professor at Ramaya International Center for Public Health Innovations at Bangalore. She also works as a consultant nutritionist and is a scientific officer. She has a PhD from MS University of Vadodara, India. Ma'am, it's an honor and a privilege to have you here and talk to our students today. Hello, was I audible?
Thank you. Yeah, hi.
Yeah.
Thank you for such a nice introduction.
Also, hello. What's happening?
You're audible, Dr.
Okay, I'm so sorry. My internet is showing that its bandwidth is slow. So I'll also like to introduce Dr. Nayandeep. So it's a privilege to have you as per here. He's been working for like 25 years now, and he has an experience in various different fields in program designing, in the what's happening with my internet? Am I audible? Am I audible?
Please go ahead, Anshika. You're audible. You're clear.
Okay, it just showed that there's no internet connectivity. I'm so sorry. Okay, so I'm so sorry. So it's a privilege to have Dr. Nayandeep sir here. He has like 25 years of experience in diverse clinical research and social settings. He brings the perspectives of public health sector, academic, medicine, the non-profit environment, and corporate philanthropy in addressing complex community health issues. His core competencies are in high impact workforce, besides effective team building and for impact delivery. He has been working as the director for Ramaya International Center for Public Health Innovations. So it's an honor and privilege to have you here.
Thank you. Thanks so much. It's my pleasure.
Now, we would also like all our participants to please keep noting down any questions which you have for us, any questions which you have for Dr. Ruchi Vadhya and Sir, and please ask them once they finish giving you an overview of it. So thank you so much. Over to you, Sir and Ma'am.
Ruchi, would you take over, please?
Yeah. Hello, everyone. Am I audible?
Yes, you're on.
Yeah, first of all, thank you for such a wonderful introduction. And I'm quite surprised to see such a huge crowd into like today's Sunday gathering. So thanks, everyone. And thank you, Mr. Bishwajit, for organizing this competition and taking our program as one of the theme. As we all have passed the age of adolescence, I would just like to bring to your notice that India, is the youngest country globally because it has almost 253 million adolescents. Almost 1/5 of Indian population are adolescent. So adolescence is, such a vibrant essence of human life. We all have gone through this phase. And we understand the psychological, emotional, physical turbulences, that occurs in this stage. In fact, I would like to say that India is facing a large problem of malnutrition, particularly undernutrition in this particular area. So almost 20% of adolescents are malnourished. And this is one of the area of concern, not only in India, but in many other countries. In fact, adolescent malnutrition is one of the target, to combat for the Indian health policies. Not only malnutrition, but almost I would like to say every second girl is anemic. And because of the environment, the food environment surrounding around the adolescent and young adult, the introduction of food industries and the fast foods, even overnutrition or say overweight and obesity, is highly prevalent in this group. Maybe because of the unhealthy eating practices and the unhealthy lifestyle. So in 2018, we have Dr. Nanjit Chaudhary with us. So in 2018, under Global Health Leadership tenure, Dr. Nanjit Chaudhary, thought to initiate a pan-India innovative program called AHANI, that is Adolescent Health and Nutrition Initiative. This is a pan-India initiative which was actually initiated in 2018 with the support of many organizations, and we have a group of volunteers working in this area, in this pan-India program. But later, it has become now it has come into a larger picture. So after 2018 and 2019, we in fact came up with a convening. We brought many stakeholders together in New Delhi. And of course, Mridula Bhargav, who is sitting with us today. So she is also one of the key volunteer of AHANI. And in New Delhi program, we tried to bring in stakeholders, including the government officials, Ministry of Family and Health Welfare, a few NGOs, particularly this AHANI India program is being supported by Igdisha Foundation, Diabetes Fighters, technically supported by Ramaya International Center for Public Health Innovations, and many such organizations came together to understand the need of adolescent nutrition campaign. Not only NGOs and government officials, but also we tried to bring parents, teachers, and schools and various other institutions, and also the adolescent. So they came up together. We discussed, we brainstormed the need of it, and how can we take that to the larger picture or the larger group. So AHANI India was developed, and it works with a mission to provide a platform for the adolescent and the young adults to gain awareness regarding healthy lifestyle and sustainable living, to make them understand that a small change in their own lifestyle can bring a difference to the world. So we came up with this mission and objective, and later, considering all the suggestions of different stakeholders, we carried out fun-filled workshops in many of the states, including Delhi, Gujarat, then Bhubaneswar, then also we are doing it in Bangalore, and we have planned to cover most of the states all over India. So what kind of workshops we do? So as I told you, we provide a platform to gain the awareness. So we conduct fun-filled activity sessions in schools. We have conducted a CPR training program to make them understand what they need to do during medical emergency. We have conducted few sessions on lifestyle, on nutrition in many schools. In fact, we have our own website. I'll be sharing the link with you all. We have our social webpage on AHANI India and Fighter Teens, where adolescents come together and understand the problems and solutions. We have our own YouTube channel, that is AHANI India YouTube channel. All these links I'll provide you to understand what exactly we do. So these all happened before COVID-19, and then COVID-19 stuck. So we all know we had faced lots of difficulties during the COVID-19 pandemic, but AHANI volunteers did not stop. We continued interacting with the adolescent in this during this pandemic as well. In fact, our internal team, thought of bringing in the psychology or the mental health in consideration. So we did a pan-India survey to understand the need of bringing in adolescent health. So while doing the mental health survey, we came to know that we carried out this survey in almost 1,600 school children and young adults. And in fact, this paper is published in one of the peer-reviewed journal. What we came to know is like 45% of this group were suffering from some amount of mild to moderate levels of stress, anxiety, and depression. And this again, brought us to to come up with some a good strategy plan and introduce healthy lifestyle program along with sustainable development goals, because we should not only consider the health and lifestyle thing, but for this, India means adolescents should look into a broader picture. So we thought that why not to bring in sustainable development goals, the UN Sustainable Development Goals. If you are not aware of, the UN SDGs are actually the goals designed by United Nations with a group of scientists in 2015, and these are 17 different goals that we need to achieve in 2030. And these are all related for leading a fulfilling sustainable life, and it considers health for all, and a better planet, better future for everyone. So we thought to bring in healthy lifestyle along with sustainable development goals and come up with some beautiful programs. So this is all about Ahani India, and now we are conducting in different schools in India, with, of course, the volunteership of different organizations, along with the Mridula's one. The mission behind, as I told you, is all about the health and sustainable lifestyle for the adolescent.
Thank you so much, Dr. Ruchi. I think this has been a fantastic background to be understood by our candidates who are participating in this competition. I would now like to invite Dr. Nayanjeet sir to actually just brief us about Rabaiya International Center for Public Health Innovations, and how can these students bring in the best in the reports that we are trying them to achieve on the D-Day.
Thank you, Mridula. And thank you, Ruchi, for giving a background. This is my privilege to be part of this excellent session where I'm going to learn a lot probably about the different perspectives that Evaluate India is bringing in. We are all learners, somebody at at a different point in the whole journey of learning, and somebody at another different point. So we all learn from each other. I just want to clarify, Ahani India is, as Ruchi mentioned, is a pan-India initiative. It doesn't belong to a particular organization. We just volunteer for it. We just started it like volunteers. We didn't want to give it any particular, affiliation to an organization. If it appeals to adolescents and young adults, they can take it forward, promote their causes to improve adolescent health, nutrition, and overall sustainable development. Now, as a technical partner, Rabaiya International Center for Public Health Innovations has been supporting the overall technical issues related to the campaign. And I'm very, very privileged to know that we have been chosen as a partner for case evaluation. And I hope one of our teammates has been designing an appropriate case for the competition. I'm really excited to know what that is. I have no idea. But I'm sure we will learn a lot from the case report or reports, for that matter, that come from different groups. I'm given to understand that, by the way, you'll have to excuse me because I'm working from my home today on Sunday and there's a pressure cooker whistle. So you have to bear with me. I'm very excited to know whatever case is being presented, how we can learn from the evaluation reports that are submitted. And I'll tell you my perspective about what we are expecting from the case reports. But before that, let me tell you about what RIGFI is in a nutshell. So essentially, we started Ramaiah International Center for Public Health Innovations to address bottlenecks in healthcare delivery systems in underserved communities. Now, when you say underserved, it doesn't necessarily mean economically poor. Of course, they are part of the target audience, but any part of the world where access to care for a particular healthcare delivery is compromised, whether it's a socioeconomic condition or it is cultural or socio-cultural environment, wherever there is a bottleneck in terms of healthcare delivery, how can we innovate locally with evidence-based approaches to solve those bottlenecks is what we intend to do at RIGFI. So it's basically an applied research center. It is attached to the well-known Ramaiah group in South India, Bangalore precisely. Ramaiah Medical College is one of the best-known medical colleges in the country. Ramaiah Institute of Technology is one of the premier engineering institutes in the whole country. Similarly, there are lots of different institutions across different streams. So these are all academic institutions in the Ramaiah family. However, RIGFI was designed to not necessarily become an academic center. It's more like an innovation center where we experiment by bringing in diverse skill sets of faculty across the different Ramaiah institutions, and also working with other organizations outside of the Ramaiah family, both in India and abroad, to address, again, bottlenecks. Now, how do we approach healthcare bottlenecks? So here are three different ways we do so, and we call all of them, facets of innovation. So number one is system strengthening exercises we do. So we have developed several models of system strengthening using multiple different, management techniques. Some of them include, but not necessarily all. You must have heard about Lean Six Sigma methods, then Kaizen methods for continuous improvement, then design thinking approaches, then a lot of psychobehavioral, social and psychobehavioral theories and methods like social cognitive theory, then Dr. Amartya Sen, Nobel laureate's capability approach. So a lot of different evidence-based modern methods of approaching management issues in strengthening systems, either within a community or within an organization, we try to apply and try to solve through consensus. So therefore, in the community, we work in about 5 districts in Karnataka today, and we work with rural communities to understand first their bottlenecks to healthcare access and then compliance to treatment, particularly for chronic illnesses, and then build a consensus by infusing into the community some of these systems that we have developed in a methodical way. Similarly, in a hospital setting or an institutional setting, we apply these methods to, again, help the hospital staff or the institutional faculty or the organizational management to identify the bottlenecks to performance in a particular domain or problem, and then come up with consensus to address, then follow up with appropriate monitoring and evaluation methods. So that's the first set of facet of innovation we do. The second is we try to use appropriate technology relevant to the context. And it does not have to be sophisticated technology. We actually, from a technology perspective, we call it frugal innovations. Innovations that are cheap, effective, at the same time, locally available and feasible to be implemented. So, of course, we use both digital technology as well as hardware technology. We believe a lot in terms of real-time data development. So we work with real-time dashboards for decision-making, and therefore, decision support system is a mainstay of all our innovations that we do, whether in the rural setting or in the institutional setting. And the third one is capacity building of providers. So whether it is a primary healthcare medical officer, or a frontline health worker, or an ASHA worker, or even for that matter, a secondary or tertiary care hospital doctor or nurse or paramedic, we try to identify skill-based gaps. Not necessarily we give a long, degree or diploma-related training, but we give skill-based, competency-based training programs so that they can perform after having gained a certain skill set. And that could be from purely, trauma management to cardiovascular disease emergency management to, managing diabetes or hypertension, or even for that matter, taking decisions based on data systems that I just referred to. So all kinds of training, which is basically addressing skill gaps in care providers, we offer. Similarly, we also, through the AHANI program that Ruchi referred to, we build capacity of teachers to be able to better deliver the Sustainable Development Goal program for the school kids. So it's all about providers, capacity building. So these are the three facets. Again, just to repeat, one is system strengthening. Number two is appropriate technology. Number three is providers, capacity building. That's all we do. We are very new. We are only about 3 years old. However, we have been doing reasonably well. And we have a very open culture. One of the tenets of our institution, which if you think you would find it inspiring, I want to share with you, is a word we call SUN, S-U-N. S for suspend judgment. We don't judge anybody. We try not to judge them. We just love everybody. I mean, at least we try to love everybody, and not try to be judgmental about anything we hear or we get. Second is U for understand others. So if we understand others, we expect that others will understand us. So that's also a principle from Stephen Covey that says, seek first to understand, then to be understood. So U for understand. And the third and the most important is we try to nurture ideas, and for nurture ideas. So suspend judgment, understand others, and nurture ideas so that our innovation gets a fillip from everybody's idea. And that's where the entire consensus approach comes in system strengthening. So this is all about, in a nutshell, what we do at RICFI. There is a website called ricphi.org. Ruchi, you might like to put it up on the chat box. I don't know whether it was under maintenance. I hope this is currently live, or it'll be live even maybe today or tomorrow. Please go through our work. We have a selfish interest of being part of this exercise here. And I have no qualms in expressing what that selfish interest is. As I said, we use the SUN principle. We love ideas, and therefore we are always hankering after others' ideas. Therefore, if you come, with brilliant ideas as to how whatever case study is being given to you, all participants, if there are brilliant ideas, we will be delighted and obliged to accept them, work on them, maybe even work with you to improve our ability to deliver the objectives of the program that is being discussed in the case study. So what do I expect then from the case reports that's going to win this competition? My first question to all the participants would be, whatever case is being offered, is the design of the program amenable to strong evaluation? Whatever knowledge of evaluation you have gathered so far, it's a great subject. I have been part of monitoring and evaluation for 2 decades now, both in India and globally. And every day is an enlightening day for me. I'm just learning. So similarly, you must be also excited about learning this new domain called monitoring and evaluation. So first of all, is the design amenable to strong evaluation? If not, then the program itself fails, right? Second, whether the evaluation that you conduct tells us whether the objectives of the program are met using rigorous methods that you are going to propose for the evaluation that eliminates possible biases. Now, what could be the biases? You must probably have known by now that there are two kinds of biases in any research, okay, particularly involving human beings. One is selection bias, whether you pick the right set of samples to get your information from, that's selection bias. And then the next is information bias. The information that is purported to be conveyed, is it meaningful? So is it really syncing with what is supposed to be extracted from the data collection? So if these biases are eliminated by the methods that you are proposing, hopefully it will tell us at the end of the analysis of your data whether objectives of the program are being met or are going to be met if the case is about a futuristic program. I do not know what the case is. So therefore, whether it's a past in a program or it's an ongoing program or a future program, I have no idea. Whatever it is, if the report is going to tell us whether the objectives are likely to be met at the end of the day, then this is a strong evaluation with the presumption that it is made of rigorous methodology and it eliminates selection and information bias. Also, if you have recommendations to improve the program implementation plan, as well as a focus on how to achieve the outcomes, I think we'll be very grateful. And finally, my selfish interest is here. We work with a lot of interns from both India and abroad. And therefore, if any bright student, when I say bright, I don't mean brilliant. I mean, you have the right attitude to come and contribute. We'll be very happy to absorb a couple of you, as our interns, work with us, help us, build our programs better. And in turn, we may be able to contribute to your career growth in both in short and long run. That's the expectation. I hope I've said enough. If there are questions, I'll be happy to sort of field them. Thanks.
Thank you so much, sir. I am sure that the students are still absorbing whatever you have said, and I am sure they are excited of the opportunities which they can have at your center and learn more. So now we would like to call upon Amrita. Amrita has been a winner of IECC 2021. She was a part of a team which had won the competition. And I'm sure her experiences will help you all to understand how you can prepare for that D-Day. So over to you, Amrita.
Very good morning to everyone. Firstly, I would like to thank Mridula and the organizing team for inviting my team for this interaction today. Unfortunately, the other members of my team could not make it, but I'm here to convey their thoughts and the insights we got from participating last year. Currently, I am the executive manager in strategy and operations unit at a government organization in Karnataka. When we participated last year, we were part of a 2-year public policy program at IAMB, and it was a great experience for us. We did not expect to win at all. It was a thrilling experience, and we got to learn so much. I think that should be the objective here, to learn about this environment. It's a very specialized area of knowledge, and it will be very useful because the development ecosystem in India is just vibrantly growing, and I'm sure the participants will get to learn a lot from this. Mridula, if you have any questions for me.
Yeah. So Amrita, I want to understand that how did you all manage to come together, and maybe the division of work? How did all that happen? Like, we were very interested in that. Students also are worried that this is a virtual competition, and sometimes they are not at a single place; they are at different places. So how did you manage that?
Yeah, physically we could not all be together, but somehow we had. I mean, the team was just great, and we all managed to deliver a good report, I would say. I think some of my learnings that in hindsight I can share is that it's better to divide the work early itself, so that you ensure that not everyone can do everything. So if you're as a team lead, I was a team lead. So if you can identify the strengths of your team members and just divide up the work beforehand, that would be great. Another, like, so a lot of rules and everything is already on was already on the website for us. I'm sure you will be doing the same this year. The team organizing team has been great in sharing all the resources and everything that you require. There is a lot of clarity in what is expected exactly. So some of it was suggested that we can keep ready beforehand, like the logo, the format, exactly what should go in. So if you have a checklist of things, it sometimes happens that in the rush of things, you're not able to complete the report, or you've forgotten about a portion of the report itself. So if the team lead can, follow up and just ensure that everything is in order, then it really helps. Um, and we did lose a little bit of time in the beginning, so we had to quickly make a judgment on that we have to divide the work up. So dividing the work up was very important for us. So the log frame, or that is the crux of the report, right? So everyone should be in agreement on that, because most of the work flows from that, right? So we were all in agreement of that. We gave it a considerable amount of time, and then we were able to put together the report.
I think we have some questions as well in the chat box. I'll read that for you. So it's Kayati, and she is asking, my question for Amrita ma'am is if she can share her approach of writing the report.
Yeah, like I said, we had divided some portions of it. So all the miscellaneous stuff in the report, that I had taken the onus of writing it and compiling it together, while my team members were giving the inputs to me. So we had a common platform. We had, we had the Google Meet running, where we were constantly checking in on what is the progress. There has to be one person who can coordinate and check the progress and ensure that we are on the timeline that we will be able to deliver. And it is important to ensure that you don't spend too much of your time on a single portion, and you're able to deliver in time.
Okay, wonderful. Next question is, what time will we be given the topic? So it's going to be in the morning itself, around 8:30, 9 a.m. We'll inform you over the mail about it. Next question is, what data did you look at when you were suggesting an evaluation framework?
Yeah, it was helpful that we already knew the theme beforehand. If you look it up, there are a lot of resources from global institutions like FAO, United Nations, all of United Nations agencies. So so you just have to keep some documentation ready. What we did was we went through a lot of, because selecting the indicators is very important for your report. You have to get that right. So we had a database ready of different types of indicators. The theme last year was related to agriculture. Our report was on climate resilient agriculture. So we had gathered a lot of data and inputs beforehand on agriculture itself from the FAO website.
Right. And this year's theme has already been announced. And Nupur, the question that you've asked, I'll be taking you through just after Amrita's presentation. So we will get to that point. Any other question that you all might have? Because this is an opportunity. She is from the winning team. of IECC 2021. So Amrita, just wanted to ask, did you go further for World Evaluation Case competition? And because the winner has to represent India at the global platform. So did you apply for that as well?
To participate in the World Evaluation Case competition. That was again a great exposure, a great experience for all of us. The pressure was much higher there because in IECC, it was just a learning platform for us, and then the stakes were much higher there. But it was a great experience. I encourage everyone to go through this when you're on a time-bound project and you have to come out with such creative solutions. You'll feel satisfied at the end of the day of the good work that you have done. Another point I would like to add is we were appreciated for the creativity of the report in IECC. So again, in the rush of things, it happens that you've put all the information together, but the presentation also really matters a lot. The theory of change can be represented very creatively. So you have to put the most creative person on in the group to do it. So ultimately, I think it boils down to your teamwork, how good you are in managing the teamwork, and how cooperative your team is.
And I think, Amrita, especially during this time of COVID, we have learned that we have to be like really quick. There might be, way less time for us to build something up or to take action upon. I think this thing has also been there, I think, in the competition, on the day of the competition, because you might be facing a lot of stress. Okay, this has to be completed. Timeline is very short. So how did you manage that stress?
It came organically, I would say. We just enjoyed the process of it. You go through the day without even realizing that you've not had lunch, or it's really a great process to be a part of. And even after the competition, now that actually 4 of my team members, we are working for the government of Karnataka now. So in my professional capacity also, I'm able to use some of these frameworks that we had to study, we got through during the competition. So it is really helpful for somebody who's looking at a career in development, especially.
Thank you so much, Amrita. It has been a great experience. I'm pretty sure you must have learned a lot, as you said. And I would like to really thank you for coming up. And now I would like to ask students to ask questions from Dr. Ruchi or Dr. Naranjeet, sir, because they have created the case. We have the theme for this year. It's creating an enabling environment for school children or children to contribute to the sustainable development goals. So when you are creating the reports, I think you must have heard Dr. Ruchi and Dr. Naranjeet talking about the background, about what do they want in that report. Do you have any question for Dr. Ruchi and Dr. Naranjeet? Please do ask us, or if you want us to connect you to the speakers, we can do that as well. You can just write it down in the chat box.
We were very clear in our presentation. Since
I think, sir, I actually have a question. Yeah. So the question is, when we are writing a report, and especially it's about enabling environment for school children. So what kind of environment are we talking about? Enabling environment, what is that environment we are talking about? Just inside the school, or around that child, around those children who might be at home or in their tuitions? What kind of environment are we talking about here?
Okay, I do not know the case study, but when I hear the word environment, I would consider two things. One is the macro environment. So environment, which is the entire physical environment in terms of, both built and natural. So that's one. The second is, of course, the microenvironment. So when I say microenvironment, I would look at a couple of things. One is the socio-cultural environment for any human being. Now we are talking about schools, therefore the target audiences are not just school children, but also teachers and staff. So the microenvironment for productivity. The factors that would be, linked for an appropriate productive growth of each individual working in that environment. Also the systems. So when we say enabling environment, so which means that the environment empowers the person to realize his or her own potential to its maximum, as a student, as a teacher, as a staff, and whatever. Well, this is all much better said than done. It's not as utopian. To the extent possible, if we can have a progressively enabling environment, I think whatever program we are designing will then be fruitful. So when we say environment, we practically mean an entire gamut of things that are within our reach, which is not in our, for example, we cannot change, let's say, CBSE curriculum, right? We have to work within that framework that the regulatory authority gives. The students, the teachers, they have own schedules. There are lots of constraints. So we have to respect them and then try to sort of innovate in such a way that the environment becomes more enabling than it is. So therefore, there has to be some benchmark based on which we would say, okay, we want to achieve this. And that's when I said the evaluation should tell us as to whether what we are proposing to achieve is actually amenable to evaluation. Can we really evaluate this? Okay, does the design allow that? So that's an entire environmental exercise we refer to. Thanks.
Okay. So just one more question. So because the theme is creating an enabling environment for school children or children to contribute to the sustainable development goals. And when we talk about sustainable development goals, there are so many SDG goals we have. Are we going to focus upon few of these goals, or students are allowed to go and maybe mention about all the sustainable goals or few of them, or whatever like they feel like? How should they be focused upon it?
Yeah, that's a very, very important question, Mridula. Practically addressing all the 17 goals would be a Herculean task. So essentially, if we can target even one goal properly, a lot of other goals will be anyway touched upon. So these goals are not really standalone silos. All right. So for example, you're talking about, the first goal is no poverty by 2030. Okay, not a single human being or family in the world is expected to remain in a below poverty line globally. That's the target. Now, can that happen without education? Can that happen without gender equality? Can that happen without environmental and climate action? Can that happen without sustainable agriculture? Can that happen without taking care of our flora and fauna? You name it. So similarly, when you talk about the second goal, which is basically hunger, zero hunger by 2030. So if in order to address zero hunger, we have to eliminate poverty, right? So these are all integrated. I think it would be nice to work on few related goals. I think the clever students would know that RIC5 works primarily with health, and therefore all important goals around health would be good enough for us to start in the school environment. So, and it does not mean only hunger and health. It could be nutrition, it could be environment, right? So it's just 4 or 5 goals if we start with and progressively build upon it. I guess we will achieve our intended outcome someday. Is that a good answer to your question? I don't know how much I'm allowed to reveal. So
no, sir, you did a great job in this, and I think students would have gained a lot from this conversation, kind of casual conversation we all had today.
We're happy to, yeah.
Yes, and any question from the students, because these questions have come from the students only over the email. So that's why we wanted to address it today. I think if there are no further questions, shall we go ahead, or just anyone else would like to ask anything?
I think please do ask questions, because this is like your last chance you will not get. I think our question has come from Harish Kumar. What is RIG5?
No, it is no, it's the name. So I think you have misspelled Harish G. This is RIGFI or RIGFI, Ramaya International Center for Public Health Innovations. We have been invited to offer a case for evaluation by the participants. Not RIG5. I like that though. RIG5, RIG number 5. But yeah, it's called RIGFI or RIGFI, whatever you call it. RICPHI.
Yes.
All right.
Thank you so much, Dr. Ruchi. Thank you so much, sir. And thank you so much, Dr. Ruchi, for taking out time on a Sunday morning. And I think students must have really gained a lot from this conversation. If there are no questions, I think we go ahead, and thank you so much, sir.
Thank you. All the best to all the participants. And thank you, Vishwajit ji, Amruta, and whoever is part of this entire exercise. Midula, thank you for having us invited. We are very excited.
My pleasure, sir. Thank you.
All the best, teams.
Thank you, everyone.
Bye-bye.
Participants, are you actually sure you don't have any questions? Because I really think that it's like your last and final chance before your D-Day. So please take a moment and think. If you have any question, please ask us.
Yes.
I mean, we can probably pause for like a minute and just wait if you have any questions. If not, we can just go ahead.
I think they can write it down in the chat box if they have any questions.
Okay, so Sheetal has asked us to repeat the theme.
Yeah, so Sheetal, we will send it over the email, and it's already there on our social media platforms. I'll repeat it for you. Creating an enabling environment for school children, public children, to contribute to the Sustainable Development Goals. That's our theme. I'll definitely take you through that in a while, like how to actually write the case and what all to be included in the report. So this is very important for you all. Let's go ahead. So this is our website, and on our website, you have to go on to the competition rules. When you scroll down, you will see the IECC 2022 rules can be accessed here. You have to click here. And over here, please go through this very, very clearly with your team, because every single thing has been written over here. The language, time, anonymity, inputs, honor code, format of submission, and very important thing, what are the components of the submission in the proposal reference? I think, Nupur, this is the answer for your question. So these are the points that you have to include in your report. You will have certain questions and answer to those. If those are correct, you'll get into the level 2 screening, but that is all for us. You will have to submit just one single report, and everything should be there according to this document. You even have what will be the judging criteria over here. Please go through this with your team, share it with your team also. I'll share the link as well, direct link to this document as well in the Telegram group. If you haven't joined the Telegram group, please do it today itself. We can ask any question, we can answer any question over there, and you have an opportunity to discuss few things with your friends and other participants as well, if you have anything to discuss. Yeah, so I think I'll stop here, and let me just take you through the final parts of the presentation. I'm sorry, was my screen visible all this time?
Yes, your screen was.
Okay. I'm resharing my screen. Yeah. So these are our social media channels, our theme, and so many other things are already available on the social media platforms, including the Telegram group. If you're not a part of the Telegram group, sorry. If you're not a part of the Telegram group, we have sent you a mail earlier. In that, we have provided you with the link. Also, if you think you haven't received any mails, please do check your spam folder. It might be over there. So this is our website. You already know about it. And thank you so much for joining us today for this wonderful session. And I'm very grateful to all the speakers we had today who took out time and briefed us about the background and about the experiences of the case. Thank you so much.